A blessed day to all of you. Welcome to our class on bioethics and sexual ethics. Our topic for today is about the general principles of bioethics. These principles are applicable not only to bioethics but in general to ethics. And there are four principles that we can discuss for this lecture. The principle of stewardship. We will also discuss the distinction between ordinary and extraordinary treatments. The principle of totality, the principle of double effect, and the principle of cooperation. Let us go to the first principle, the principle of stewardship. Pope Pius said, "Man in truth is not the owner of his body, nor its absolute lord, but only its user." The formulation of this principle can be attributed to Pope Pius XII, and this principle of stewardship recognizes God's authority over human life, health, and human body. The human person is but a steward, a caretaker, and therefore not at liberty to dispose himself or herself. He or she must always be guided by divine law. This principle puts emphasis on two things. First, God as the source of life. And second, we, human beings, as good stewards, as caretakers of the life God gave us. We are not the absolute owners of the life God gave us because it came from God. We are just caretakers, we are stewards. And part of our responsibility is to take care of the life God gave us. Let us look at the different dimensions of stewardship. On the personal level, our concern is about the life and health. As a good steward, as a good caretaker, how do I take care of my life? How do I take care of my health? Do I get enough sleep? Do I take care of my physical well-being by eating the right food, making time for exercise? These are some things we can do to take care of our life and our physical well-being. On the social dimension, we can put emphasis on the stewardship of resources and also the preferential love for the poor. We are social beings. I am not alone in this world. I am with my brother, I am with my sister, I am with my neighbor. And part of stewardship is not just to think of myself, but to think of how can I promote the good of others, especially those who are in need. The preferential love or option for the poor. For example, in this time of pandemic, how can I become a good neighbor to others? Well, we can mention observing the proper protocols, wearing a face mask, wearing a face shield, observing physical distancing. It will be unchristian not to follow these protocols because it might put our neighbor in danger. So that's part of the social dimension of stewardship. Ecological dimension of stewardship is stewardship of creation, taking care of our environment because this is our home. Do I contribute to the cleanliness of the surrounding? Do I conserve water, knowing that some people do not have access to water? So these are some concerns on the ecological dimension of stewardship. On the biomedical dimension of stewardship, we can mention research and experimentation on human beings. For doctors and scientists, when they perform experiments on human beings, how do they look at the human person? Do they look at the human person as an object or a thing to be used? or as a person with dignity that needs to be respected. No? I remember reading this post from Archbishop Anthony Fisher of Sydney. He posted that the government in Sydney sponsored or supported a research for a vaccine that would somehow address the COVID-19. But the problem is, of all available sources of the vaccine, the government chose to sponsor the research that would involve using tissues, cells from aborted babies. Well, of course, the search for the vaccine is good. That's a good end, but it does not justify the means. If it would mean involving killing lives of innocent babies, you become a cooperator to the act. And so because of this, Archbishop Fisher, along with other religious leaders, came up with a statement for the government to consider other options that would be ethical, options that would not include killing of innocent lives. So that's part of the biomedical concern on stewardship. Now, let us discuss the difference between ordinary and extraordinary treatments. This is very important, especially in dealing with the different bioethical issues. Ordinary or proportionate means are those that, in the judgment of the patient, offer a reasonable hope of benefit and do not entail an excessive burden or impose excessive expense on the family or the community. Extraordinary or disproportionate means are those that, in the patient's judgment, do not offer a reasonable hope of benefit or entail an excessive burden or impose excessive expense on the family or the community. It does not mean that extraordinary means special and ordinary means regular treatment. No. It depends on the situation. Ordinary treatments refer to the treatments that must be given to the patient because the patient has high chances of recovery given these ordinary treatments. Whereas extraordinary treatments refer to treatments that may not be given to the patient because the patient's condition has no chance of recovery. For example, a patient who is in coma and the doctor told you that the patient has no chance of recovery and it just depends on the life apparatus attached to him for his survival. Now, that kind of situation is an extraordinary treatment. And it is ethical to pull the plug because of the given situation. We just have to acknowledge that the patient has reached the natural end of his life. So that's important, the distinction between ordinary and extraordinary treatment. Well, a person has an obligation to use ordinary or proportionate means of preserving his or her life. Ordinary treatments, they are obligatory and must be given to the patient, but a person may forego extraordinary or disproportionate means of preserving life. Forgoing extraordinary treatments is not killing. It is not euthanasia. It is acknowledging that our life on earth ends, naturally ends, and we just have to accept that fact and prepare ourselves for the life to come. So, forgoing extraordinary treatments is ethical. It is not euthanasia. It is not mercy killing. Let's look at case number 1. HB, which is an acronym. In bioethical cases, the name of the patients are not disclosed because of confidentiality. We just use acronyms for patient. So HB, an 80-year-old male patient, was admitted in the hospital because he suddenly felt very weak. After a series of tests, it has been discovered that he has a benign tumor in the brain. This weakens his ability to move. The doctor gave him two proposals to address his situation. A, perform an operation to remove the tumor, or B, do not perform the operation, but he has to take medications. The doctor told him that the operation is very risky and expensive. There is no assurance that he will regain strength. There's even a possibility that the tumor might return, and given his age, other sickness might surface after the operation. Now, if this patient, HB, comes to you for advice, do you think it is ethical to choose the second option? What do you think? Of course, we need to identify if a situation is extraordinary or ordinary. Well, first, he has a benign tumor, and benign tumor are not cancerous tumors. It grows slowly, no? It does not harm the patient, but if it grows to the point that it affects other organs, then it can have some effect on the patient, which is on the case of HB. Now, the operation to remove the benign tumor is very risky and very expensive, and there is no assurance that given the operation, the tumor will not recur. So, given this case, performing an operation is an extraordinary treatment, meaning it is ethical to forego the operation given the situation. What does the Catechism say about ordinary and extraordinary treatments? Let's look at paragraph 2278. Discontinuing medical procedures that are burdensome, dangerous, extraordinary, or disproportionate to the expected outcome can be legitimate. It is the refusal of overzealous treatment. Here, one does not will to cause death. One's inability to impede it is merely accepted. The decisions should be made by the patient if he is competent and able, or if not, by those legally entitled to act for the patient, whose reasonable will and legitimate interests must always be respected. Paragraph 2279. Even if death is thought imminent, the ordinary care owed to a sick person cannot be legitimately interrupted. The use of painkillers to alleviate the suffering of the dying, even at the risk of shortening their days, can be morally in conformity with human dignity if death is not willed as either an end or a means, but only foreseen and tolerated as inevitable. Palliative care is a special form of disinterested charity. As such, it should be encouraged. So, the Catechism says, foregoing extraordinary treatments is not killing the person. It is moral, it is ethical given the situation. What happens if you forego the extraordinary treatments? When cure fails, our ability to care continues. Even if there is no hope for the cure, you still have to take care of the person until the person reaches its natural end. We should continue giving nutrition and hydration, love, concern for the patient, and prepare the patient for the next life. So that is what one can do in case extraordinary treatments are withdrawn from the patient. Let us go to the second principle, the principle of totality. Pope Pius XII says, but in virtue of the principle of totality, of his right to employ the services of the organism as a whole, he can give individual parts to destruction or mutilation when and to the extent that it is necessary for the good of his being as a whole, to assure its existence or to avoid, and naturally to repair, grave and lasting damage which could otherwise be neither avoided nor repaired. Well, the principle of totality simply states that in the human person, the part exists for the whole, and therefore the good of the part is subordinated to the good of the whole. The good of the whole, the good of the whole human body has priority over the good of the part. So in cases where certain body parts needs to be removed, needs to be mutilated, it is okay, it is ethical, as long as its removal would contribute to the good and well-being of the whole. That is what the principle of totality tells us. But there are conditions. Let us look at the 3 conditions where mutilation of a part of the body is considered ethical. First, the continued presence or functioning of a particular organ within the whole organism is causing serious damage or constitutes a menace to it. The damage must be remediable, or at least can be measurably lessened by the mutilation in question, and the operation's efficacy in this regard should be well assured. Third, one must be reasonably certain that the negative effect, which refers to the mutilation and its consequences, will be compensated for by the positive effect, the elimination of danger to the whole organism, easing of pain, and so forth. So, in order for us to appreciate this principle of totality, let us look at a classic example. RC has a gangrenous leg. The doctor advised him to amputate the leg so that the other parts of the body will not get infected. If he chooses not to amputate the limb, there is a possibility that the infection will spread throughout the body. Is it ethical to remove the leg? Gangrenous leg means RC has decomposing limb, is infected, and if the leg is not removed, the infection might affect the different parts of the body. So let's look at the conditions. So first condition, the presence of the body part or the organ is causing serious damage to the organism. Check. Second, it is remediable. By removing the gangrenous leg. Check. And third, the negative effect will be compensated by its positive effect. The removal of the gangrenous leg would contribute to the health and well-being of the whole body. Check. So, in this case, the removal of the decomposing limb of the gangrenous leg of RC is something ethical. Let's look at another case. Case number 3. AJ is a male homosexual who had several partners. His current partner, who makes him feel loved and accepted, requests that AJ must undergo sex change abroad. His partner is willing to finance all the necessary expenses for the procedure to take place. Now, is this kind of mutilation ethical? The mutilation of the male sex organ. Let's look at the conditions. First, well, the presence of the male organ does not cause serious damage to the whole organism. And since there is no damage, there is no need, no necessity to remove the male sex organ. So in this case, it is unethical to undergo sex change using the principle of totality. Okay? Let us go to the next principle, the principle of double effect, or it is also known as the principle of indirect voluntary. Why is it also called indirect voluntary? Because an action is done willfully, voluntary action, but the bad effect is indirectly willed. That's why it's also called indirect voluntary. St. Thomas Aquinas explains this principle in his Summa Theologiae when he talks about killing an aggressor as an act of self-defense. Now, let's look at how St. Thomas Aquinas formulated this principle of double effect. A single act may have two effects, one which is intended in intentione, while the other is incidental praeter intentionem to that intention. But the way a moral act is to be classified depends on what is intended, depends on your intention, not on what goes beyond such intention, since this is merely incidental thereto. An act that is properly motivated may nevertheless become vitiated if it is not proportionate to the end intended. And this is why somebody who uses more violence that is necessary to defend himself will be doing something wrong. So it says here, an act properly motivated may be vitiated, immoral, in other words, if it is not proportionate to the end intended, self-defense. Like for example, if you have an enemy and the enemy hits you with a stone, and in the process of self-defense, you threw a knife to the enemy. Now the damage brought about by your action of throwing the knife is not proportionate to the damage done by throwing a stone. So this is an example of more violence that is unnecessary in the act of self-defense. A more simple formulation of the principle of double effect says, an action may have two effects, one good and the other is evil. And in order for the action to be considered as ethical, there are four conditions to consider. First, the action itself is not ethically evil. Second, the good effect is immediate or simultaneous. Third, the purpose of the agent is the good effect, the intention. And fourth, the reason for acting is proportionally grave. In order for us to appreciate this principle, let us look at this case. OB, who is 5 months pregnant, was rushed to the hospital because of severe abdominal pain. It was discovered that she had ectopic pregnancy, the development of the fetus outside the womb, that is ectopic pregnancy. The doctor advised that in order to save the life of OB, the fetus must be removed from the mother's body. And of course, that would mean ending the life of the fetus. Is it ethical to do the operation? In cases like ectopic pregnancy, if the fetus has developed to a certain point that it can be delivered by cesarean section, then that should be the best thing to do. But if ectopic pregnancy is life-threatening to the life of the mother, then the principle of double effect takes place. One action would have two consequences, one good and one bad. The intention must always be good. So in this case, the intention must be to save the life of the mother. But in the very act of saving the life of the mother, the baby dies. And using the principle of double effect, then that is considered ethical. As long as we always intend, we always choose the good intention and not the evil intention. The last principle is the principle of cooperation. Cooperation means any free and knowing assistance of an individual or institution, cooperator, in an immoral act performed by another individual or institution, the principal agent. Formal cooperation takes place when one concurs with the evil intention of the wrongdoer. So if there is consent, if you agree with the intention of the principal agent, that is formal cooperation. Material cooperation, on the other hand, consists in an involvement where one does not intend the evil intention of the wrongdoer. Meaning to say, there is no consent. No? You do not agree with the intention of the principal agent, no? But you choose to cooperate materially, no? In the performance of the evil act. Material cooperation can be further identified into mediate material cooperation, which occurs when the cooperator assists in or contributes to the non-essential circumstances of the immoral act. A non-essential circumstance of an immoral act makes possible that act. And immediate material cooperation occurs when the cooperator assists in or contributes to the essential circumstances of the immoral act. An essential circumstance contributes to bring about the immoral act of another. Let us look at some examples to understand the distinction between mediate material cooperation and immediate material cooperation. For example, a nurse, a Catholic nurse, who works in a hospital suddenly discovered that the hospital performs abortion. And as a Catholic nurse, he does not agree with abortion because abortion is an evil act of killing the lives of innocent babies. But still, this nurse continues to work in the hospital. And his act of working in the hospital, preparing the things used for the operation for abortion, that is immediate material cooperation. Material cooperation because the nurse does not agree with the principal agent. He does not agree with abortion, but it is immediate because the very act of performing the instruments is essential to the performance of the immoral act. Now, what about the guard who works in the hospital? Well, his involvement in the act of abortion can be considered mediate material cooperation because his work as a guard is non-essential to the performance of an immoral act. The question is, may you cooperate in unethical procedures? Moral theologians emphasize these points. First, formal cooperation is always immoral. Formal cooperation is when you agree with the evil intention of the principal agent. It is always immoral. Immediate material cooperation is likewise immoral. Why? Because the action of the cooperator is essential to the performance of the evil act. That's why it is also immoral. Mediate material cooperation may be moral. If one does not agree with the intention and his cooperation is non-essential to the evil act, then his mediate material cooperation may be considered moral. So these are some points that moral theologians would bring about in cases involving cooperation in an evil act. Let's look at this case. Case number 5. RS was delayed in her menstruation. She informed her boyfriend about this, and a week later, it was confirmed that RS was pregnant. They both admitted they are not ready yet to have a baby. RS wanted to abort the pregnancy. Her boyfriend agreed with her. What kind of cooperation did the boyfriend of RS manifest in this situation? Is his cooperation ethical or not? Well, the very act of the boyfriend agreeing with the intention of the principal agent, which is RS, no, that is formal cooperation, and therefore it is something unethical or immoral. Okay, so that's our lecture for today. For any questions, just message me or post your questions in our virtual classroom, and I will try to address them. For our exercise, for our homework, I will give you cases, situations, and you will give your evaluation to these cases using the principles we have discussed today. That would be all. Keep safe and God.